Thank you, Mariambo. Daktari, you've heard the report. What is your take in regards to what Marie compiled for us, considering that DRC Congo has been at the fore recording so many cases, and in this case, 500 lives so far have been lost?
Yeah, so first of all, just going back to what has been mentioned about Mpox. Mpox is not endemic in Kenya. Mpox has been found to be endemic in West Africa and Central Africa. And right now, because of Democratic Republic of Congo, we had cases that were mentioned earlier. Even in the early 70s, the first case of Mpox was reported in a child in Democratic Republic of Congo. And now we are seeing, in 2022, we had what we call clade 1A, which was spreading in Congo. But now we have also, and that clade 1A was mainly from animals to humans. But now what we are seeing is clade 1B, which has mutated from clade 1A, that is now more transmissible from human to humans. And what we are thinking as scientists is that because of the immune system, this virus has been exposed to the human immune system for some time. And because of the mutations that are happening in the virus, it is more easily transmissible between human beings. And DRC is unique because that is one of the places where we have the rainforests, and that's where the animal-human transmission happens, because the original virus is actually a zoonotic virus. That is, they are spread from animals to humans. But now we are seeing human-to-human transmission because we think that this virus has mutated, and we have evidence to show that because we have looked at the mutations in the viruses, and we think these mutations are because of the immune pressure that happens in human beings, and the viruses are mutated to reach a place where they're able to be comfortably transmitted from one human being to another. And the cases you have seen in Kenya are actually mainly from people who have traveled from DRC through Uganda and so forth. All the three cases we have had are for people who have been traveling.
And maybe, Daktari, for someone who is just joining us right now, we would like to understand what is Mpox.
So Mpox, in a layman's language, is a virus that is very closely related to smallpox, which was eradicated many years ago. So Mpox started coming up in the early 70s. And scientists think that because when smallpox was eradicated, Mpox, which is transmitted from animals, came about because now we do not have what we call the immunity to fight these viruses, because most of the vaccines that were developed for smallpox, when they were removed from the market, we now found that people are more vulnerable to transmission of Mpox. And Mpox is a virus that, as I said earlier, is mainly found in animals, but now it's being transmitted to human beings. And what normally happens is that when you're infected with Mpox, many people may not show symptoms, but children and people, especially people whose immune systems are suppressed, people actually develop the disease, and they show the symptoms. They have lesions on their skins, they scratch a lot, they feel tired, they have headaches that don't go away, and they also have fevers. So that is how you can define Mpox to be. Yeah.
We have had the third case in the country today. From where you sit as KEMRI, what interventions have we put in place?
So first of all, I must say that KEMRI doesn't work in isolation. We work with the Ministry of Health. And the Ministry of Health has what we call the Rapid Response Team. So the Rapid Response Team is made up of laboratory scientists and public health specialists. So we have people who are around the country who are collecting samples in what we call surveillance. And these samples are sent to the testing laboratories. We have a network of testing laboratories in the country. And from the COVID-19 experience, we also have at the borders where people are stationed to look at people who are traveling, because most of this virus is now being transmitted by travelers. So we find that the virus is transmitted easily from people who are traveling. So what we are doing even at the border regions is that we are screening people to see if they have symptoms, and if they have symptoms, they are isolated and tested. If they are confirmed to be positive, then they are put in isolation until when they recover.
It will also be interesting to understand the transmission from animals to humans, whether it's a reality. But before we get into that, on set with us is the Deputy Director, Center for Virus Research at KEMRI, Dr. Samuel Hamadi, and this evening we are discussing Mpox awareness. We are taking our first commercial break on this. We'll be back with more. Stay with us.
Unafika huku kwetu ya mkutano? Siamini.
Amini usiamini, Holiday Bonanza ni ya kila mtu na zawadi zitakufikia mahali popote. Dial *570#, chagua option 4 na zawadi kibao zinakungoja. Ikiwa kila wiki kuna 250,000 Kenyan shillings za kushindaniwa. Ni *570# pekee, option 4, tushinde.
What was ordered is different from what was delivered.
Unajua ng'ombe ilitoka anakaa kama farasi.
What are you doing? Angalia.
Pole. Unaona kitu yoyote?
Mimi niko na shida akiriri.
Mimi si chailoko ya kukukopeshanga na ulipi.
Singing is really good and I really love it and I enjoy it. I would like to collaborate with an artist called Size 8 because she's really a good singer and I would like her to help me in nurturing and growing my talent.
I love today's book. And you know why? Because it has some of my favorite characters' names.
Today I'm going to show you guys how to make the yummiest chicken fried rice at the comfort of your home.
Where's my dad?
Glad you're watching. It's a Friday and we are on our interactive segment, and tonight we are discussing Mpox awareness. On set with me is the Deputy Director Sector for Virus Research, KEMRI, Dr. Samuel Hamadi. Before we went on a break, we were discussing on the issue of animals to humans infections. How is it related to Mpox?
So first of all, just to mention that many of the viruses that we are now seeing that are infecting humans are actually endemic among animals. And when human beings are in contact with animals, chances are they will get infected with these viruses. And Mpox has actually been shown to be one of the zoonotic viruses that are spread from animals to humans. And so the disease may not be severe in animals, but when it affects human beings, you find that the severity of the disease is higher, and even the mortality of the cases.
So what are the do's and don'ts that you think is very key for public awareness?
So for us, first of all, I'd like to say that because, like, for example, in the city, we are not close to animals and wild animals. And something that we should also thank God about currently is that we don't have what we would refer to as a community spread of the virus that is being spread from one human being to another, especially in Nairobi and other parts of Kenya. It has been spreading mainly from people who have traveled outside Kenya. So the thing that we can do is to have what we call to observe general hygiene, like washing of hands, and also avoiding greeting people with our hands, avoiding crowded places. And if you are traveling, you make sure that you take care of yourself. And the issue of sharing clothes, especially for people who, if somebody is suspected to have Mpox, if they share their clothes with somebody else, the chances of transmission are very high. So those are some of the basic things that we should avoid.
Dr. There have been a concern about vaccines, and many people are worried whether they should or not consider these vaccines that to some extent they're already in discussion. What is your take first in regards to vaccines that we take?
So first of all, I want to say that vaccines are very important, and we have seen the eradication of diseases like smallpox through vaccination. I think what we need to ask ourselves now is, why have we taken so long to get vaccines like for Mpox? Because this is not the first time we are having an Mpox outbreak. And even as Mpox has been reported, we are not seeing vaccines being given to the people who need the vaccines. So like, for example, right now, the biggest effort should be giving the vaccines to where the source of the virus, especially in DRC, so that we do what we call prevention. But having said that, considering the spread of Mpox compared to COVID-19, Mpox vaccination should probably be given to people who are at high risk of getting infected, and not the general population, especially because of the cost and the availability of the vaccines.
Are we as a country ready to handle this, supposedly it mutates to the level of COVID-19?
So first of all, I'd like to say that as you've seen the cases being mentioned in the country, we had 1 case, now we have 2 cases, now we have 3 cases. And you can look at it epidemiologically and say that it will not be like COVID, because COVID spread, and the way it was spread and the way people are getting infected is very different from Mpox. So we believe that Mpox can be controlled and managed properly. And even people who get infected with Mpox, many of them, Mpox is said to be self-limiting in most cases, that people recover on their own. So we are thinking that we will not have a situation like that of COVID-19. But having said that, we need to be careful. We just need to observe the things that I've mentioned. And as a country, we need also to make sure that vaccines are availed to those people who are vulnerable to getting infection with Mpox.
Supposedly, it gets to that level. It mutates to the level of COVID-19. What will be the challenges that we would face, not only in Kenya, but Africa also, in handling this?
So I think Africa, one of the biggest challenges is the challenge of resources. We don't have resources to manage the diseases. We don't have enough vaccines to give to our populations. We don't have public health experts who are trained. We don't have enough clinicians. So I think if we reached that point, then we would be swamped the way we were swamped with COVID-19, and probably our health facilities wouldn't be able to manage the pandemic if it became a pandemic. So what we can say right at the moment is just to make sure as a country that we can do the bare minimum to make sure that we are able to contain the virus. Like, we have enough isolation points. So if we have people who have been exposed to those who are already confirmed to be cases, these people should be isolated and from the general population, so that they can be managed accordingly to prevent the spread of the virus. So those are the basic things that we can do. And we did so well during the COVID-19 pandemic, and that's why we had very few fatalities compared to other countries or even other continents.
As much as we have the challenges of resources, for those who have already had this disease, what are the resources available for them from where you sit in the Cambry perspective?
So I think, speaking from a public health specialist perspective, I would say that for those ones who are already affected or exposed to the virus, I think the important thing is just to make sure that we are able to manage, these people are managed accordingly, because as I said, in most of these viral diseases do not have a drug per se for their cure, but the symptoms can be managed. Like fever can be managed, the headache can be managed. And so we just make sure that these people are isolated, they get good hygiene, they drink enough water, so that their health improves as fast as possible, and they are managed accordingly, so that they do not infect members of their families. Those are the basic things that we can do as Kenyans.
Dr. As we come to the close, schools have been reopened, and also we still have public gatherings. What will be your word to them as we come to the end?
So for us, I think one of the things that we are doing, like when we are discussing issues of outbreaks, one of the important things we refer to is surveillance. And surveillance is where you are looking for possible cases of people. So like in schools, if you have somebody who is portraying these symptoms, these people need to be isolated immediately. So it means that like in the schools, we need to have the clinical officers working there make sure that they check the hygiene of the children every day. They check their health status and find out if there are any children with fever or headaches, and make sure that they respond to them and check for any symptoms. If these people are isolated, then we'll be able to manage the disease. And even in the general public, the things that we can do is just to make sure that we are able to, as much as possible, to avoid like shaking of hands and having close contact with each other. Because to a certain level, there are certain things we can do, but to a certain level, it reaches a point where you can, like, avoiding public places we cannot avoid, going to the shop, going to the village market where there's crowding. There are things we cannot avoid, but the important thing is that if you see a case or a suspected case, this should be reported immediately to the nearest health facility, and this person should be isolated, and this will help us to contain and manage the spread of the virus.
Dr. in few words, how do we protect the vulnerable? How do we ensure we give them the information that they need?
So one of the things that the Ministry of Health is doing is that we are developing materials for communication so that we inform the public on how this virus is spread or how it can be managed. And by so doing, the public will be able to be the first line of defense for this country, because they'll make sure that they observe general hygiene, and also if they see suspected cases, whether it is suspected to be chicken pox or whatever infection that somebody else, as long as this is reported to the nearest health facility, then these people can be managed. Then secondly, something that we also need to do is to scale up training of healthcare workers so that they can be able to identify the cases early. And thirdly, to train the people in the health facilities so that when they see cases, they collect samples properly, so that these samples, when they are tested, we get a definitive result. Because one of the challenges may be that samples are not being collected properly, and so we may not be having a real picture of what is going on. But with good training, then we'll collect samples from the field and be able to test and be able to get results that are reliable.
Thank you, Dr. Looking forward to have more sessions with you in regards to the same and beyond. On set with me is Deputy Director, Center for Virus Research at KEMRI, Dr. Samuel Hamadi, whom we have been discussing matters on Mpox awareness. And just before I get back to you, Kago News just in, Chuka Girls High School has been closed indefinitely as the girls have demanded to go home. We'll be giving you the developments as they unfold. This can also be found on our website, www.kbc.co.ke. Kago?
Thank you so much, Irene Muchuma, for that very insightful interview on Mpox awareness. Speaking to Dr. Samuel Hamadi, Deputy Director, Center for Virus Research at KEMRI. Many thanks indeed for that, as we continue to bring you an update of the news that's been shaping up today. And the continuation of the news, the government has enlisted the services of national government administration officers to conduct a public participation exercise across the country on the planned launch of Maisha Number. Immigration and Citizen Services Principal Secretary Ambassador Professor Julius Bitok has urged Kenyans dissenting views on the Maisha Number and Maisha Card to seek clarification at the forums.
A day after ruling out mandatory Maisha card registration in the country, the government on Friday tasked regional and county commissioners with the responsibility of facilitating the smooth rollout of the registration.
We have called upon our regional commissioners, our county commissioners, our sister department of internal security and national administration to help us actually be able to roll out public participation around the country.
And let me now take this opportunity to call upon members of the public to be alert and to be ready so that they can have that opportunity to go to these engagement forums and give their opinion as far as Maisha Number and Maisha Card is concerned.
After meeting the officers at the Kenya School of Government in Nairobi, Immigration and Citizen Services Principal Secretary Ambassador Professor Julius Bitok reassured Kenyans that the Maisha Number registration will not compromise the integrity of their individual data.
There's no data breach that you have. In fact, things are now much better with Data Protection Act that we have in place now. And we are complying with it. We are following every step to ensure that we are within the law in whatever we do with Kenyans' data.
The PS has expressed confidence that the registration process will not be impeded by the litigation issues surrounding it. He has confirmed that the government has printed 1.6 million Maisha cards and that all new applications of Maisha cards will cost 300 shillings.
We have been able to print and distribute 1.6 million Maisha cards so far. We are working on a Maisha number where the systems are being aligned well, but the same number of cards we have issued is the same number of Maisha numbers we have issued. We have been able to issue also 1.6 million because when we are issuing Maisha cards, it is the Maisha number that's printed on the Maisha cards.
Joseph Ohungu for Easy Friday.
All right, now, Umoja 3 residents are blaming the Nairobi County firefighters for, listen to this, being too close yet too far following a fire incident that left 2 dead last night. You have details of this and other stories from the counties.
The dead included 2 children aged 7 and 3 years respectively. According to Umoja 3 residents, the 2 were locked up in a house when the fire incident occurred. It is believed the fire originated from a lit candle which was left unattended. The fire left at least 30 families homeless.
Kaacha mama yao kama amewafungia na kifuri ndani. Sasa venye kado iliisha, ilishika manguo zenye zilikuwa hapo kando. Moto ikaanza kutokea. Sasa watu wakajaribu kuizima, ikazidikana.
Enkisi County Assembly